President and colleagues, at the beginning of this year, the Trump administration empowered unaccountable AI companies to delay and deny certain types of care in traditional Medicare. Now, Donald Trump promised that he would not touch Medicare. And today, it is clear that that Trump promise has been broken. Seniors paid into Medicare out of every paycheck during their working years, and they did so with an expectation they would have an ironclad guarantee of affordable health care. Today, seniors in 6 states across America are discovering that care their doctor has recommended for them has been slowed or halted by a shadowy, AI-driven third party. The consequences are not abstract. Seniors with severe back pain have to wait weeks for relief, upending their lives and leaving them suffering because of the bureaucracy of health care. The types of care that are subject to these restrictions are not frivolous. Knee arthroscopies, nerve stimulation, steroid injections, cervical fusion. These types of procedures are the care that seniors rely on to stay mobile and pain-free in the aging process. Now decisions between doctors and patients are overridden by for-profit AI contractors. The Trump administration's only defense of this model has been to point to the rapid rise of skin substitute procedures to justify their flawed experiment. But the Trump administration's work doesn't pass the smell test. First, the Centers for Medicare and Medicaid Services already have now lowered payment rates for this procedure. In doing so, closed the loophole driving the dramatic increase. Second, these skin substitute procedures only account for a tiny fraction of care under the model. In the case of Oregon's neighbor to the north, Washington State, skin substitutes account for less than 1% of services, less than 1% of the services, Madam Chair, subject to the prior authorization under this model. So the excuses hold no water. Prior authorization has run rampant in the American healthcare system. For-profit insurance companies are increasingly using this business tactic to block and deter care in order to increase their profits. I want to put a fine point on this. In 2024, insurance companies that sell Medicare Advantage plans denied more than 4 million prior authorization requests. Just think about that. 4 million prior authorization requests. Of those denials, only 1 in 10 were appealed by a senior or their doctor. But when the denial was appealed, it was overturned 8 times out of 10. What this tells me is prior authorization is being used to deny legitimate care, often acting as a bureaucratic hurdle meant to discourage seniors and their doctors from pursuing a course of treatment that might impact an insurance company's bottom line. It is bad enough, Madam President, that this is the state of affairs in Medicare Advantage. But now the Trump administration is trying to import insurance company tactics into traditional Medicare. And that would mean that seniors selected precisely because they don't want to deal with the headaches and complexity of an insurance company would suffer. This is not a partisan issue. Many of my Republican colleagues have expressed concern about prior authorizations in the state of Medicare Advantage. I hope that they'll stand with those of us today who want to tell the Trump administration to abandon an ill-advised experiment that seniors don't want, they didn't ask for, that doesn't make sense. There's a lot of work to be done to improve both traditional Medicare and Medicare Advantage for seniors that count on the Medicare guarantee. And Madam President, I've been working on that Medicare guarantee since the days when I was the co-director of the Oregon Gray Panthers. Let's work on that together, and we can start by ending this AI-driven prior authorization experiment. It's a mistake. We can't run the risk of it being sent to other parts of the healthcare system. I urge a yes vote, and I yield the floor.